Imagine a Nigeria where every citizen thrives and contributes meaningfully to the nation's social-economic development, where citizens easily access optimal productive health services. In acknowledging the vital role of family planning to achieving this, the government of Nigeria strategically expanded the family planning method mix to include the hormonal IUD some years back.
Our role is to make sure that we crush maternal mortality as a goal. For the family planning, the role is to ensure availability, accessibility to the commodity, to ensure that it also contributes to the reduction of maternal mortality. So that is the major role. So within the availability and the accessibility, there are a lot of functions that we play in specifically on family planning.
The introduction of hormonal IUD as part of the method mix is for women of reproductive age to have multiple choices to make. They have more methods to choose from. Because you agree with me, if we're having only one or two method mix, when you are counseling, you counsel only on these two, which that comprehensive counseling will not be there, because you need to counsel women on different types of methods. So from there, they will be able to make choice, to choose which one they want. So, and hormonal IUD came in to broaden the choice of women.
EngenderHealth, in implementing the HIUD scale-up project in the past 3 years, has contributed significantly towards the achievement of this goal.
We will speak in terms of numbers. In the last 3 years, through support from the Catalytic Opportunity Fund, we've been able to contribute to over 3,000 hormonal IUD insertions in Nigeria, working specifically in Sokoto, Bauchi, Kebbi, Plateau, and now Kogi and Ebonyi State. And if you translate those numbers in terms of couple year protection, we're hitting almost 15,000 couple year protection. But beyond those really high outcome numbers, I would like to speak about how we've been able to drive capacity building through using the competency-based approach of the Federal Ministry of Health. And this has allowed us to be able to train currently almost 800 healthcare workers across the states, allowing us to contribute as an organization to over 20% of the overall target for capacity building for the Federal Ministry of Health.
The State Ministry of Health, one of the major visions and goal of the ministry is to actually reduce maternal mortality and underfed mortality, and also as well improve the other health indices. For us to reduce maternal mortality, uptake of family planning is very necessary. For gender health today, the hormonal IUD services were being offered in the state. When you check my visitors, the uptake of family planning generally was low, especially hormonal IUD. And when I go further, I discovered one is that the people, the staff with the necessary skill for this for instruction, they are very few. So, but when they came, more staff were trained. I'm sure by now we have over 150 something staff that can comfortably provide these services.
And again, we fully partner with EngenderHealth. They have been very, very proactive. They were with us last year throughout. We were able to have an engagement with them. They train our personnel, and last year it was very, very fruitful.
The state's family planning coordinators, master trainers, and satisfied users also share their stories.
Hormonal IUD, the uptake was very low in neighboring states before, and part of the reason for this was the lack of manpower, less capacity. The provider doesn't really have the skills on how to provide that particular method, which is hormonal IUD, and we have just only 4 providers trained at state level for this service.
Before the EngenderHealth came in, we have about 4 facilitators trained. So when on HIUD insertion, and we had less than 10 insertions done before August. So they came in to train about 25 champions from different facility levels, tertiary, secondary, and high volume primary health centers. So together with their medical record officers.
So, but following the EngenderHealth, when they came, so they took, they selected 25 facilities. These 25 facilities include 23 health facilities and 2 training institutions. And these people were trained on hormonal IUD. Their capacity were built, and to enable us as a state to have higher number of manpower that has in there, the human resources that can provide this method. That is why each of these facility champions were tasked to go back to your facility and train additional 5 members, which we call them cohorts, and that was how it ran. So each of these 25 facility champions went back to their various facilities and selected 5 cohorts members, and we train them. So looking at it now, we have about 150 providers that can confidently provide hormonal IUD in the state.
The 25 people that was trained, we were made to realize that they are going to cascade the training to 5 people in officers in their facility. But then they still pick some from few close by facilities, so that at the end of the day we will have more providers in more facilities. And when there is attrition, that is transfer of staff, the facility, the champion, the training, we still have people to continue.
We followed up to ensure that they recruited the cohort members, and then I and other master trainers began to conduct a follow-up coaching visits to the facility. And at each of the visits, the first visits, we helped them to do a step down to their cohort members. And then subsequently, we start helping them to conduct capacity training on hormonal IUD insertion technique.
So, on getting to the facility for supportive supervision, using the checklist from the Federal Ministry of Health, the supportive supervision checklist, we'll use it to mentor them, we'll explain to them.
When there was issue of data disparity, there was a move that they engaged through our state HMIS and went to facilities for data harmonization. And this is to ensure quality data, to ensure that whatever that is reported is actually the right, correct data, and it is reflecting at DHIS point 2.
They supply all the 25 facilities with both instruments, IUCD instruments, the Sister U, we call it Sister U, that's the pelvic model that is specifically meant for hormonal IUD. They supply the whole 25 facilities.
We also provided the facilities, supported facilities, with training model which we call Sister U for demonstration. And this is to help sharpen their skills before they begin to insert other live clients. They also provided, they supplied us with insertion kits with headlights which is very important for visualization of the cervix during this section. Before now, like I said, from January to August 2025, the Ebonyi State could record of 19 hormonal IUD across these 25 facilities selected by supported by EngenderHealth. But within this period of September till December, because I know that January data will still come, so we've recorded about 457 hormonal IUD insertion on live client.
Between August and December, the uptake of hormonal IUD has increased from 5 to 477 insertions in the state.
Myself and my cohort member, we are about 7 family planning providers now. We are more confident and competent in our skills, and we provide excellent counseling to these clients. Initially, before the training, around January to August 2025, we had little to no insertions of this hormonal IUD. After the training took place August 2025, between September 2025 to December, we had over 30 insertions of hormonal IUD.
All the family planning services are being rendered here except HIUD, which was introduced to our service after my training, because I was one of those people that are being trained on HIUD by Engender. And with the introduction to the mothers, they enjoyed it, and we are able to, at least we have done 33 insertions from August to date.
I heard hormonal IUD through community mobilizer at Adabia PHC. I now discuss it with my husband, and he now tell me to come for it. When I came to the facility, they welcome me, they make me feel comfortable. They now introduce the different type of family planning, and I now choose hormonal IUCD because it is very effective. I decided to come for family planning because I want to space my children. Since I took the hormonal IUCD, it is very effective. There is no complication, there is no any side effect, and I'm very happy. I'll advise other women to go for it because it is very effective. You will be safe, you will be very happy, and it is very good.
The policymakers in both states are enthusiastic about sustaining the gains of the project.
EngenderHealth came in quite long, and their intervention encouraged the state to improve the budgetary allocation from 51 million to 121 million in 2026.
So the state government is very committed to family planning, and I believe that this very year will put much more effort at whatever is our provision in the AOP as for family planning centralized this very year.
We've employed more hands, more trained personnel, and we've also procured family planning commodities. Even our budget for family planning has also increased. By this year, we have increased by almost 300% compared to what it was last year.
I will say this project, if I'm specific for this project, it has helped to contribute to the expansion of the method mix for women. And it has also made sure that it's done in a way that is institutionalized. It's not done like a pre-campaign approach, which after the campaign, everybody then relax. And we've been quite intentional, trying to strengthen systems. I mentioned earlier about how we've been able to engage both at the supply chain side, engage on the M&E side, at the capacity building, the budget and financing side. And if you look at all of these elements, they really are elements of the health system strengthening building blocks for WHO. So we believe this approach means that we are institutionalizing model IUD and expanding the method mix for clients across Nigeria.
So it's all of us putting all our heads together to get the goal, to get to the goal that we have set, the target that we have set for ourselves in family planning and reproductive health in general.